Hey there, welcome back to East Texas Live. Joining me now is Dr. Carl Hill from the Alzheimer's Association, and he's here to highlight a very important issue. The Alzheimer's organization is now ensuring health equity in dementia care for underserved and underrepresented populations. Tell me about that.
I tell you, it's really important. Equity. People need resources in the fight against Alzheimer's and dementia, education, awareness, support for caregivers, referrals. Those are resources. So equity means they need these resources in the ways that they can best utilize them.
Yeah, and it's kind of hard to comprehend this because diseases aren't aware of race or social status or ethnicity. So what are the barriers that are driving these different statistics that we see?
I tell you, lack of education and awareness, differences in that around various communities, or stage of diagnosis, knowing when to go see a doctor about memory loss is so important. So that's why equity is really important, that we get the word out to communities in ways that they can best use it.
Are we having issues in participation for some of these underrepresented communities when it comes to the studies and development of treatments? Because if so, that seems like it might be a big deal. Really
important issue here. We need more representation in the clinical trials. Right now, Hispanic, Latinos, African Americans represent less than 10% of all trial participants. So it's important that they are recruited and participate so that we know that treatments are safe and effective for all people.
Well, we'll never get the answers without proper participation, I imagine. All right, so let's talk about more things that you guys are doing to sort of fill in these gaps.
It's really, we're working, we have chapters all over Texas, working with local organizations to get our resources to communities in equitable ways. And so that's partnership with organizations. If people know who we should be working with, please let us know so that we can reach out and do this work together.
So I saw in your notes there was something you were talking about, anti-amyloid treatments. Now you're a doctor. I have no idea what that means. Explain to the rest of us this more specific part of what y'all are dealing with.
Really exciting time. So we're in the treatment era for Alzheimer's disease, and that means that there are two FDA-approved treatments that reduce amyloid in the brain. Amyloid, I won't get too technical, but it's the reason why people develop plaques and tangles that disrupt memory, right? And so if we can keep amyloid levels at a certain level or reduce them, people won't go into the cognitive decline and and end up at moderate or severe dementia. So really exciting. We've got to get this information out to all communities in ways that they can use them. Again, that's equity, but really excited about the treatment era.
Okay, now tell me about this partnership between you guys at the Alzheimer's Association and the Ad Council.
Well, in the spirit of equity, we're working with the Ad Council to get information about the importance of the 10 warning signs or going to see a doctor about memory loss in English and in Spanish, working with Hispanic Latinos that represent their community so that people can see themselves in these ads and say, hey, it's time for me to go and see a doctor. And so we're really excited about this partnership because it allows us to get our resources out again in an equitable manner. So exciting work.
I get excited when you say treatments because it feels like this whole time we've just been trying to understand Alzheimer's, what causes it and what are the chemicals involved and whatnot. To be actually in that next step and doing something about it, this is the exciting part for y'all.
And these treatments are not a cure. Now, I tell you, they slow the cognitive decline, but to your point, previous to now, we've only been treating the symptoms and really providing resources to caregivers. And so more treatments are in the pipeline. We know more about what's good for the heart is good for the brain. So lifestyle is important here. So research is really giving us some hope, and I'm looking forward to where things will go in terms of reducing risk for all populations in all communities, and the Alzheimer's Association is here to help in that regard.
That's great because myself, probably everyone watching has known someone that's had to go through this, an older family member. And a generation ago, if you had Alzheimer's, what could they do for you? Nothing. There was no treatments or whatever. But there's a lot of hope coming behind you, Carl.
And that is, really a testament to the research community and, really relaying those results to those of us that are working in public health and communities to get people these resources. So I'm very hopeful. More work to do in health equity, but really excited about our partnerships with the Ad Council. Thank you for having us here and all of our partners to do the work for the Alzheimer's Association.
All right, great message of hope there, Doctor. All right, for more information on the Alzheimer's Association, alz.org. Easy to remember, 3 letters, alz.org.